Hello, it is Dr. Michael Youssef, and I'm going to talk about the macrovascular complications of diabetes. We can identify the macrovascular complications of diabetes as conditions or diseases affecting the large blood vessels, and it is usually due to poor glycemic control. It is aggravated when it is associated with other risk factors as hypertension or dyslipidemia or insulin resistance. And we should not forget that smoking is another risk factor which increases the possibility to develop macrovascular complications. Here I'm going to focus on the macrovascular complications uh, affecting the cardiovascular systems as well as the complications affecting the peripheral arterial circulation. So first let us put a highlight on the cardiovascular complications or diseases which increase up to fourfold among diabetics, and I'm going to talk about two main diseases. The first serious condition which I'm going to talk about is the ischemic heart diseases or coronary heart diseases. It is one of the most common cause of mortality and morbidity among diabetics. And here we should not forget that some patients, especially when they have neuropathy in particular, autonomic neuropathy will not present with the typical angina symptoms. This condition, which we call it silent ischemia. So from our side, we should never miss to make regular assessment and check up for the heart and to predict the presence of any ischemia as early as possible. This can be done either by stress or exercise ECG, nuclear imaging, or ambulatory ECG monitoring. Um, Lipid control and management of dyslipidemia uh, using lipid lowering agents as simvastatin or atorvastatin plays an important role to reduce the risk to develop coronary heart diseases. This is by lowering the level of low density lipoprotein and very low density lipoprotein, and on the same times it increases the level of high density lipoprotein. These all will play an important role, as I mentioned, to reduce the risk to develop ischemic heart diseases. The second cardiovascular complication which I'm going to talk about is a stroke. Stroke is responsible or is the most common cause of disability among diabetics. Stroke is more liable to occur when poor glycemic control is associated with other risk factors as overweight, dyslipidemia, or hypertension. Controlling the blood pressure together with controlling the dyslipidemia and weight management showed significant effect to reduce the possibility to develop a stroke rather than if we concentrate only in proper or strict glycemic control individually. So now we are going to move to another macrovascular complication of diabetes, which is the peripheral arterial diseases. Diabetes usually affect the peripheral circulation by narrowing the large blood vessels of the lower limbs, leading to impair the peripheral circulation, which in turn impairs the healing of any wounds affecting the lower limb. This wound in this case will be very high liable to be infected. This condition, we call it the diabetic foot ulcers, and it is usually worse when it is associated with peripheral neuropathy or diabetic arthropathy. Foot ulcers should be managed strictly from our side by giving the proper broad-spectrum antibiotic as well as proper vascular assessment and management and proper surgical management and nursing. Foot ulcer is a condition which we should not wait to happen, and we should work hardly to prevent it from the beginning by regular foot assessment, detecting any foot deformity, regular checking for the peripheral circulation and vascular assessment, as well as to advise the patient for the proper footwear and proper hygiene. Like this, we put a highlight on the most common macrovascular complications of diabetes. Thank you so much for listening.